Good morning. My name is Dr. Michael Arvystas. I'm a professor of orthodontics at Montefiore Medical Center, Albert Einstein College of Medicine. In the June issue of the Journal of the World Federation of Orthodontics, I published an article entitled "The Diagnosis, Sequencing, and Management of Bilateral Horizontally Positioned Palatally Impacted Maxillary Canines with Closed Surgical Exposure and Immediate Light Continuous Orthodontic Traction." My motivation for documenting this article was for educational purposes for our orthodontic residents and the many malpractice claims involving orthodontists with the management of impacted canines. I have chosen a difficult maxillary canine impaction case to illustrate the timing and proper mechanics used to achieve an ideal result in an adult female patient. This picture shows a frontal photograph of a patient who came in for a second opinion, and her major concern was the aesthetics of the over-retained deciduous canines that were present in the maxillary arch. These intraoral photographs illustrate a class 1 occlusion with over-retained maxillary deciduous canines. This panoramic radiograph illustrates the severity of impacted maxillary palatally impacted canines in a total horizontal position at the base of the floor of the nose. This cephalometric radiograph illustrates the position more clearly of the horizontally positioned maxillary canines. These intraoral photographs illustrate a lever arm system that was used to move the maxillary canines away from the roots of the maxillary incisors in a light continuous force manner, not taxing the premaxilla. The premaxilla is protected by a heavy rectangular arch wire supporting the maxillary arch. The panoramic radiograph shows the lever arm system immediately after placement after maxillary canines have been exposed. The typodont illustration displays the lever arm system that was used intraorally on this patient. These intraoral photographs are illustrating the use of an overlay arch to start bringing the canines from a lingual to a labial position. And this arch wire, in addition to that, is a base arch wire supporting the maxilla. The intraoral photograph shows another overlay arch disengaging the maxillary canine, and because it's an overlay arch, the canine bracket is fully engaged with this rectangular wire, bringing the root of the canine into a more mesial position. Please note the fact that the maxillary right canine has a left maxillary canine bracket on it, so the torque system and the tip of the root of the canine is going from a distal tip of 11 degrees to a mesial tip of 11 degrees, helping to upright the canine tooth. The intraoral photographs here show one canine almost being in its ideal position, and the left canine has an overlay arch that's engaging the bracket of a right canine bracket, bringing the root of the left canine into a more mesial upright position. The intraoral photographs here are illustrating the fact that the maxillary mechanics that are being used, there's a base arch wire, rectangular base arch wire, an overlay arch wire uprighting the canine root, in addition to a distalizing Wilson arch that is creating mesial distal space for the canine to be placed in the maxillary arch. The intraoral photographs presented here show the ideal placement of the canines into the maxillary arch. The right and left canine are in their proper position, ideal class 1 position. Periapical radiographs were taken sequentially of the movement of the canine from this horizontal position to a vertical position. These intraoral radiographs illustrate the sequence and timing of the movement of the maxillary canine away from the roots of the central incisors and the uprighting of the roots of the maxillary canine from its distal position to a more mesial upright position in the oral cavity. The intraoral photographs illustrate the ideal position of the right maxillary canines that were basically in a horizontal position that were brought down into their ideal position and an ideal class 1 occlusion. Intraoral photographs illustrating ideal arch form and the bonded lingual retainers to prevent the vertical relapse of the maxillary canines, which went from a horizontal position into the oral cavity. Panoramic radiograph illustrating the horizontal impacted maxillary canines pre-treatment. Panoramic radiograph illustrating post-treatment position of the maxillary canines. Pre-treatment, post-treatment cephalometric radiographs illustrating the movement that was achieved of the canines going from a horizontal to a vertical position in the oral cavity. Cephalometric tracings of the pre- and post-treatment radiographs illustrate the fact that the maxillary molars were distalized and the maxillary incisors were maintained in their ideal original position. Facial photographs illustrating the aesthetic results that were achieved in the placement of the maxillary canines into their ideal position, showing good alar support, lip support, and a smile that is proportional to the patient's face.